On the 31st of October, Boris Johnson announced that there would be a second lockdown.
Good evening.
He was giving a Downing Street press conference flanked by Professor Chris Whitty on one side and Sir Patrick Vallance on the other, using a number of graphs and data to justify his decision to bring in national restrictions.
The problem was that we were just seeing too many cases really taking off across the whole country.
However, subsequently, it's been suggested that the data that he relied upon was effectively dodgy.
First slide, please. As you can see, the weekly case rate for COVID, which is in the darker colours, mean that the numbers are worse. And on the right, you can see the rate of change. Anything in brown or yellow, the rate is increasing. The darker the colour, the more rapid the rate of increase.
This map shows the geographical spread of the virus across England by comparing 2 different weeks, the 12th to the 18th of October and then the 19th to the 25th of October. The government intends to show the spread of coronavirus across the country. This data shows the range of change of coronavirus cases across all local authorities per 100,000 people. Alarmingly, the map shows that the rate of change was 46.5 per 100,000 people. However, taking the weeks of the 19th of October and then the 26th of October, the rate of coronavirus cases was actually up 5.2 per 100,000 people, not 46.5. So what does this mean? The government presented data showing that the rate of change of coronavirus cases was 9 times more than it actually was at the time. Cases were not increasing as fast as the government had insisted. In fact, if we zoom in on Liverpool, cases had actually fallen by 60%. Considering Liverpool was one of the first towns to go into the 3-tier system, was this proof that actually the regional restrictions were working and we didn't need a second lockdown at all?
Data from the ONS, the Office for National Statistics, which is the official data, shows that the prevalence of this disease has been going up extremely rapidly over the last few weeks.
To show the rate of coronavirus infections in the community, the government used data from October the 17th to the 23rd. They said the weekly increase in the proportion of the population infected was 0.25 percentage points. But newly released data shows the actual situation at the time of the press conference. In fact, the weekly increase in those infected was 0.09 percentage points, 3 times less than the figure that was presented at the press conference. What this shows is that coronavirus cases had actually started to stabilise.
If we look around the country, thanks to the work that everyone is still doing, the R is substantially lower than it would have been if people were not doing the social distancing, were not doing all the things in families, in firms, around the country. It would be going up much more rapidly than it is at the moment.
The government shows infection rates per region, and at the time the North West was thought to be one of the worst affected regions, with cases increasing at nearly a rate of 3%. Chris Whitty said that cases in the North West were stabilising rather than falling. Cases in the North West were actually falling at a rate of 0.24 percentage points. So what does this mean? The North West is the only region in England where cases appear to be falling, according to the current data. Places like Greater Manchester, Lancashire, Warrington had all been placed in local lockdowns even before the tier system was brought in.
And we're now beginning to see this with a rise in the number of hospital admissions in England by age group, and this is just looking at people at different age groups. There is a rise in virtually every age group in older adults, basically anyone over the age of 45.
These graphs show the number of hospitalisations increasing at an alarming rate. Newly released data shows the trend of confirmed cases was stabilising by the time of the presser, but also that new hospitalisations were stabilising too. So what does this mean? This shows hospital admission rates beginning to follow the same trend as infections, in that they are beginning to stabilise. However, the number of people in hospital still continues to rise. This is because typically there's a lag between somebody being infected with coronavirus and actually confirmed as having tested positive with it. Then, of course, you've got another lag between them being tested positive and actually being admitted to hospital. Action probably was needed to ensure that hospitals weren't overwhelmed, but does that necessarily mean we had to have a second lockdown?
So just to recap, these are three different ways of looking at it from different studies or the consensus group from the modellers of the number of people every day catching COVID new, and it's 50,000 plus most likely as the number, and perhaps 500,000 people or more overall with the disease.
Here the government presented three different estimates of overall coronavirus infections. Since then, the Office for National Statistics has updated their estimate. Initially they said the estimate was between 38,500 and 79,200. Then they narrowed it down to 37,700 and 59,600. So what does this mean? The ONS revised their figures because coronavirus infections began to stabilise. It's perhaps worth noting that the two other estimates weren't revised. So the ONS estimate narrowed, showing that daily cases of coronavirus had stabilised.
The next slide shows the early working from 2 weeks ago of some of those groups looking at deaths in England over the winter period. There's the potential for this to be twice as bad or more compared to the first wave.
The next graph was included to show different working estimates of what winter deaths might look like. Although all of the different estimates varied, the conclusion largely was that the winter peak would be bigger than the spring peak. Vallance himself said this will be twice as bad as the first wave, or even worse. The projection was based on an R rate of between 1.3 and 1.5, even though the R rate at the time was between 1.1 and 1.3. Whitty subsequently told MPs at the Science Selects Committee that 1,000 deaths was a more conservative estimate and backed that up with new figures. He also said that the idea of us reaching the peak that we had reached in April was entirely realistic. It means that the long-term projection that was presented on October the 31st should have been a lot more realistic and a lot less alarmist. Instead of the figure of 4,000 deaths a day, 1,000 would have been more accurate.
This shows the hospital daily admissions. You can see the first peak on the left-hand side, and then over to the right-hand side you come up to date, today, and then the projections forward over the next 6 weeks.
This graph shows daily hospital admissions over the next 6 weeks, and this shows daily deaths projected over the next 6 weeks. The shaded graphs alarmingly show rapid growth rates, well exceeding the first peak. Since then, the upper end of the graphs was revised and the government was forced to issue new graphs. Instead of 1,500 deaths, it recommended an upper figure of 1,010. Meanwhile, the top range for daily hospital admissions falls from 9,000 to just over 6,000. The changes completely change the dimension of the graphs, showing that actually, at its worst, the peak is not going to outstrip that of the first wave. In fact, what the new projections do really is make the figures more on a par with the first wave, rather than being bigger than the first wave. The new graphs issued by the government show that the initial projections were far too high. It tells us that actually the government's tiered regional system was in fact working. Yes, there was a concern about hospitalisations that needed to be addressed, but when you consider that the government had to revise their own data, it does beg the question as to whether the second lockdown was needed in the first place.